Hello, and welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie Heronopoulos, and today we're talking about bioidentical hormones. In 2002, the results of the Women's Health Initiative study raised questions about the safety of hormone replacement therapy for menopause. Since then, women have understandably been looking for alternative treatments to relieve the symptoms. Many talk show hosts and self-help books promote bioidentical, customized, compound hormone replacement therapy as a safe and natural way to treat menopause. But this publicity has perpetuated confusion and misconceptions among the lay public as well as medical professionals. Today, we welcome Dr. Reinaldo Tirado, a local endocrinologist, to help us clarify some of the misconceptions. Welcome, Dr. Tirado.
Hi, thank you. It's a pleasure being here with you, Stephanie.
And thank you. Well, my first question to you, to tell our viewers, is what is the difference between bioidentical hormones and compounded, customized replacement therapy?
Well, there's actually everything is bioidentical hormones. We're trying to reproduce the same molecule that the body is producing. And it's also, all of them are synthetic, even the molecules that we use and put in the compounds to make a custom compounded formulation. The only difference is that custom compounded formulations are not FDA regulated or approved. We have the FDA approved regulation that are the bioidentical hormones that are the ones that are raising all these questions.
I see. When you take compounded, customized hormone replacement therapy, those medications are not FDA approved and are not regulated.
The compound itself is not the one that's regulated, but the actual molecule is the one that has been approved to be used as a bioidentical hormone. Is progesterone or estradiol, estroestrone. I mean, there's only one way that we can do that, and it's all manufactured in a laboratory. The same way that we do it, and the pills that we have usually are FDA approved, but they had to be introduced into the custom compound.
One of the misconceptions regarding this compounding is that it's natural, therefore it must be safe. What would you say about that?
Well, it's not natural. It's all synthesized in a laboratory. What it is that it's made one-on-one. It's not a big batch made in a big pharmaceutical company sent to everybody at the same time at all the pharmacies. It's basically some pharmacies take this and they make their own formulations, and they may say that the first formulation that this pharmacist did here was a different strength than the one that the man sitting next to him is doing. So that's why it's custom compound.
So no batch standardization for it. Okay, so women go and they get a saliva test to check for what their hormone levels are before the compound is produced, the recipe. Tell me, everyone thinks that saliva is accurate and reliable. What would you say to that?
Well, I mean, some physicians and some people are proposing that saliva testing is very accurate. But the problem with the saliva testing is that your saliva is different every minute of the day. So it's not a very reliable testing to do because it changes so much. It's an ultrafiltrate of blood. Mm-hmm. So it all depends on how you're filtrating these compounds into the saliva or sweat or other body secretions to maintain. We have serum blood testing has been screened and scrutinized for years and years, and every laboratory has to go through rigorous testing for control quality, right, so we can maintain normal reference ranges.
If you want to have bioidentical hormones, because it sounds like it's exactly what your body would produce, and you want to have it, there are FDA-approved bioidentical hormones. Can you talk about that?
Well, they're basically the ones that are prescribed by your physician. Is the regular ones that we use ethinyl estradiol. We use progesterone. We use equine estrogen. Some people are very afraid of the equine estrogen because they're unconjugated and they have to go through the liver and they can cause other things that can raise some risk factors. But if you're afraid of those, we can use other type of molecule that doesn't have to go through that, and it will decrease the risk of that.
When we talk about progesterone, I think this is an important subject for my viewers to know. Progesterone cream is not absorbed well through the skin, correct?
That's correct. It's not well absorbed.
Okay, so here's the story. If you have a uterus and you're postmenopausal, you need to be on both estrogen and progesterone because estrogen has stimulatory effects of the uterus and can lead to thickening of the uterine lining and endometrial cancer. So you have to be on that progesterone to protect your uterus. And if you're on a cream that doesn't get absorbed properly, how do you know if that medication is protecting your uterus?
Unfortunately, that's one of the problems that we have with estrogen cream. We can give you levels high enough that will cure some of the vasomotor symptoms that you have from menopause, but it won't give you enough concentration to protect the lining of the uterus. And that's why we need to use the oral ones that can give us a higher dose of that, because the absorption is very variable depending on what the person uses the cream too. There's a lot of changes in the way that the body absorbs when you put the cream too.
Well, thank you very much, because I believe that that is a very important point for the viewers to understand and know regarding the compounded bioidentical hormones. So thank you for being on the show.
A pleasure.
And we'll have you again talking about other issues. And
Appreciate
if
it.
you
Thank you very
would
much.
like temporary relief from the symptoms of menopause and are a candidate for hormone replacement therapy, talk to your physician about the risks and benefits of treatment. And if you're interested in bioidentical hormone replacement, know that there is a list of FDA-approved bioidentical hormones that have been tested and regulated versus customized compounding bioidentical hormone replacement that is not. For more information on this topic and more health news, check out Your Health with Dr. Stephanie, which runs every Thursday in Florida Today's Health section, or visit floridatoday.com.